hydroxychloroquine trial to restart. Trials of the controversial anti-malaria drug taken by the U.S. President Donald Trump to try to prevent catching coronavirus are to be resumed. We've been noticing President Donald Trump not wearing a mask. Is this in demonstration to show this drug might be working? Or maybe it's just out of rebellion. We don't know. UK regulators said hydroxychloroquine and a similar drug, chloroquine, can be given to healthcare workers, and a clinical study to test the theory. Recruitment to the COP trial have been paused amid concerns about side effects raised by other research that has since been discredited. This other research has been discredited. That work looked at treating COVID-19. It concluded that the drug was not beneficial, increased the risk of irregular heart rhythms and death. That publication led to the WHO suspending its coronavirus treatment trials of the anti-malaria drug. Concerns were raised about the data, and then some of the study's authors said they could no longer stand by their publication in The Lancet, as the healthcare firm Sugar Spear that was involved in the work would not allow an independent review. The New England Journal of Medicine retracted another paper that had data from Sugar Spear. The cheap and widely available drug has been safely used to prevent malaria infections for years. What progress are we making on coronavirus treatments? What do we know about hydroxychloroquine? Although studies suggest hydroxychloroquine is not a lifesaver for people who are already ill with coronavirus, researchers are keen to continue exploring whether it might prevent infections. As a matter of fact, if the infection isn't severe and hasn't created critical severe damage to organs, it's also proving to be helpful in those situations. The COP trial will see chloroquine, hydroxychloroquine, or a placebo given to more than 40,000 healthcare workers from Europe, Africa, Asia, and South America. One of the lead researchers, Professor Sir Nicholas White from the University of Oxford, said hydroxychloroquine could still prevent infections, and this needs to be determined in randomized controlled trial. Co-investigator Professor Martin Llewellyn from the Brighton and Sussex Medical School said, although rates of coronavirus are low just now in the UK, healthcare workers are still being affected across the NHS, and a second wave of infection this winter is widely expected. In terms of finding an intervention that could protect key workers by this winter, hydroxychloroquine is by far, the most realistic prospect. The recent post-exposure prophylactic study confirmed its safety and indicated that it could be protective if given as a pre-exposure prophylactic. This is what COP will find out. Meanwhile, the anti-HIV drug lopinavir and rotenavir have been found not to provide any clinical benefits to patients hospitalized with coronavirus, but some recovery trial recently discovered that a cheap steroid called dexamethasone can help save the lives of patients who are seriously ill with the virus.
Well, I think there's enough responsibility to go around, but the spike in the ages from 25 to 34 really coincided with the state's opening up of bars in our area and clearly throughout the state. We've got a spike that we are dealing with, and we promptly put a mask order for our area, the city of Tampa, in place. And as I'm sure you're aware, the research shows that if everyone wore a mask for 2 weeks, we could cut down 80% on this virus. And so we've had great adherence to that mask order.